Well, Assam has witnessed yet another sharp single-day rise in positive cases of COVID-19 after as many as 8 people tested positive within just 12 hours. What have set the alarm bells ringing are the fact that 4 positive cases in Guwahati, out of which 3 individuals had no travel history. As per sources, the 4 COVID-19 positive cases reported in Guwahati include a postgraduate student of the Guwahati Medical College and Hospital, a woman from Guwahati's Chandmari locality, one person from the Barooah Cancer Institute Cleaners Colony, and one other individual who is currently under quarantine at the Saraswati Sports Complex. Meanwhile, 4 other positive cases were also reported in Silchar, who are the co-passengers of the COVID-19 patient who had travelled from Ajmer. However, what seems to be the biggest cause of concern right now is that the contact history of 3 COVID-19 patients in Guwahati is yet to be ascertained. This has raised further concerns about the threat of community spread, and well, the only need of the hour currently is that everyone takes precautionary measures to combat the spread of this deadly disease. Let me also remind our viewers that earlier 8 persons who had attended the Tabligh Jamaat had also tested positive in the span of just a single day. And meanwhile, Assam has recorded its second death due to COVID-19. That's right, viewers. The victim was reportedly a resident of the Barooah Cancer Institute Cleaners Colony in Guwahati. And as per sources, the person identified as a 16-year-old girl had passed away after spiking a fever. Later, after her swab sample was tested, it was found that she was also positive for COVID-19 as well. As per sources, the victim's grandmother is a cleaner at the Barooah Cancer Institute. And meanwhile, news has come in that the cancer hospital has been ordered to be shut down for a period of next 3 days. That's right, viewers. It has been known that the hospital has been ordered to be shut down for the next 3 days. Sources have also pointed out that the hospital is slated to be sanitized later today, and contact tracing in the area is to be initiated during this time period. And earlier, we had a talk with our editor-in-chief, Wasbir Hussain, regarding this entire development regarding COVID-19 in Assam. Let's listen in to what he had to say.
4 passengers of a bus that had carried 42 pilgrims from Ajmer, 42 pilgrims from Assam. They had returned 3 days ago from Ajmer. One of them was declared positive day before yesterday. And yesterday, when people realized that one of the 42 passengers was a COVID-19 positive patient, then, they carried out rapid tests of various people, and 4 more people were found positive. This was the first development. The second big development was, later in the evening, in fact, quite late in the evening, 4 more people were declared COVID positive in Assam, and all these 4 were from Guwahati. But significantly, as we have been saying, out of these 4, only one had a travel history. He had recently returned to the state from outside, and he was home quarantined. He has been declared positive. Now, who are the other 3? Out of the other 3, as we have said, one is a Guwahati-based doctor, and the other is a lady from the city's Chandmari locality. Now, this accounts for 3. Now, what is significant is the 4th COVID positive patient. This is a 16-year-old girl. It was a 16-year-old girl who died actually. And following her death, her swab was taken and was tested for COVID, and she was found to be COVID positive. Now, this brings us to the issue whether that 16-year girl is the second COVID positive death in Assam. The first was a person from Kachar district in Silchar. That was the first case, and this is the second case, 16-year-old girl. So these three developments. One, 4 people in Guwahati test positive for COVID. One of them has already died. And in fact, we have come to know that the 16-year-old girl was suffering from COVID only after her death. Among the other 3, one is a Guwahati-based doctor, one is a lady from Chandmari, and one, of course, is someone who has returned outside and was in home quarantine. And the other 4 were among the 42 pilgrims who had returned in a bus from Ajmer in Rajasthan, after visiting the Dargah in Ajmer Sharif. And out of these 42 people, one was found to be, doctors found some symptoms of COVID and tested, and it was found to be positive. By that time, everybody in the bus had gone home. They had spent a night there, but it was just desperate beat by the district administration and the health authorities to find them. They were tested, and 4 of them have now confirmed positive. This has taken the total active cases in Assam now to 18, and the total number of cases in the state to 53. So this is the broadly situation. Now, several questions arises, Raunak. Several questions arise out of this, because particularly the case in Guwahati, as to if out of the 4, only 1 had travel history, how did the other 3 contract the virus? That is the big question. The big question, if only 1 of the 4 had a travel history, how did the other 3 get the virus? That is the big question. That is the big question. Whether it is a question of community transmission, we cannot yet say. But the alarm bells definitely in Guwahati, which might force the authorities to relook at some of the relaxations given to the lockdown. That, it is better not to rule out anything. We cannot confirm that it is community transmission, but for the safety of the people, safety of the Guwahatians and the visitors, it is best not to rule out anything. Therefore, we have to be on our guard. We have to see, there has been relaxations given to the lockdown, but I would like to appeal to the people not to unnecessarily venture out. If you have something very, very urgent, you can go out. Educational institutions are closed. Private offices are open with 30% attendance. Communication is allowed with 50% attendance in buses. In private vehicles, driver and 2 passengers. So these are some of the restrictions imposed by the government. Now the question is, it will become clear whether Guwahati will be, come into the orange zone or the red zone. So this is a matter we have to wait and watch how the health authorities would categorize, Guwahati following the 4 new cases that have emerged. One of the cases have already, of course, died. So out of the 3 cases, one is a Guwahati-based doctor. So that has also to be ascertained as to how this doctor contracted the virus, whether he was coming in contact with the patient, whether any of the 3, it was a patient doctor, whether any of these 3, one of them is a doctor, whether the other 2 were his patient. So these are the things which we have to wait and watch. This has already caused a lot of concern in the among the health authorities in Assam, and of course they are going to definitely take a relook at the relaxations. And later in the day we are going to know as to what action the health authorities are mulling. But one thing is for sure, that we cannot take anything for granted, and the need for caution, need for to be on the whistle has only increased now. And therefore, we have to appeal to the people not to venture out unnecessarily, although the authorities have given certain relaxations. Otherwise, the government will be forced to come up with more stricter measures, enforce the lockdown, perhaps withdraw the restrictions.